دكتورة عدنان شمخي، اختصاص أمراض الدم سليل البالغين، تدريسية في كلية الطب جامعة بالغ قسم الطب الباطني. اليوم راح نحكي عن الأكيوت ليمفوبلاستيك لوكيميا لطلبة المرحلة الخامسة. Let's start about the objectives of our lecture. Start by the scientific definition of acute lymphoblastic leukemia and then how to learn to evaluate the patient with certain symptoms to reach the diagnosis, and eventually how to treat the patient with acute lymphoblastic leukemia. The beginning is, by definition of acute lymphoblastic leukemia, is a malignant neoplasm of lymphocyte that characterized by clonal accumulation of immature blood cells in the bone marrow. These abnormal cells are arrested in the lymphoblastic stage of maturation pathway. In this picture, show the lymphocyte that is arrested in the lymphoblastic stage of its maturation pathway. Acute lymphoblastic leukemia is a most common leukemia among children. It accounts for 76% of leukemia. The median age at diagnosis is 13 years old, and nearly 60% of cases are diagnosed under the age of 25. Regarding its etiology, in most of the cases of acute lymphoblastic leukemia have no etiological factor. Other hypotheses show an environmental agents that's included in its etiology, such as chemicals, ionizing radiation, have been implicated, and there is a congenital predisposing in Down syndrome and Klinefelter and Fanconi anemia. Regarding its clinical feature, the patient presented with symptoms of only for few weeks duration that resulting from bone marrow failure or extramedullary involvements by leukemic cells. Up to one-half of the patients presented with fever or documented infection. Other presenting symptoms including fatigue, dizziness, lethargy, and hemorrhage, although a severe hemorrhage is uncommon. Approximately one-half of the patients presented with organomegaly such as hepatomegaly, splenomegaly, or lymphadenopathy, or extramedullary involvement like central nervous system involvement may be presented with headache, neck stiffness, or vomiting. Leukemic cells can be infiltrate testis, retina, and skin and cause spectrum of symptoms according to the organ involvement. Regarding the diagnosis, the presenting feature generally reflect the degree of marrow failure and the extent of extramedullary disease with anemia, neutropenia, and thrombocytopenia, and hyperleukocytosis that commonly occur in T acute lymphoblastic leukemia. About 10% of the patients lack a circulating blast at diagnosis. That's why a bone marrow aspirate is a mandatory. In addition to extramedullary involvement with the predilection of central nervous system is common, leukemic blast can be identified in about 5% of adult patients at diagnosis by examination of the cerebrospinal fluid. Regarding the lines of treatment, first, we should pay attention for supportive treatment. Careful attention should be paid for supportive treatment to prevent metabolic and infectious complications, pain control, hematological issues, and antiemetics. To prevent nausea, vomiting, other supportive measures that include placement of indwelling catheter for insertion of chemotherapy and psychological support for the patient and its family. Let's start by the definitive treatment, that's with a chemotherapy. It will be divided into a remission induction and consolidation, then a maintenance treatment. The start by remission induction regime typically includes a glucocorticoid and vincristine as a backbone to treat adult patients with acute lymphoblastic leukemia. Additions of anthracycline will improve the rate of complete remission. Modern induction protocols that incorporate L-asparaginase and cyclophosphamide or both. Regarding remission consolidation, if remission has been achieved by remission induction, then we proceed to remission consolidation to eradicate any residual disease. This consists of a number of courses of chemotherapy, again resulting in periods of marrow hypoplasia. If poor prognosis disease that carries certain criteria, this will maybe go ahead with allogeneic bone marrow transplantation. Regarding remission maintenance, if the patient is still in remission after the consolidation phase for acute lymphoblastic leukemia, a period of maintenance therapy is given as oral chemotherapy, such as daily mercaptopurine and methotrexate, with the individual as an outpatient treatment consisting of repetitive cycles of the drug administration. This may extend up to 3 years if relapse does not occur. And thank you.